Hi, everyone. Thanks for joining us today. We're going to let some folks filter into the room and we'll get started in just a minute or so. Good morning and good afternoon to everyone. We'll be getting started in just a minute. All righty, we'll just go ahead and get started now. Hello, everyone. Thank you for joining us here today. I'm Linda Mitchell. I'm CEO of Allergy and Asthma Network. Welcome to this afternoon's webinar. We're in for a real treat today. We have Melissa Paige here from NAMAPA as today's presenter. I have a few housekeeping items to go through before we get started. First of all, everyone's on mute today, and we will continue to keep everyone on mute as we go through this webinar. We will be recording the webinar and posting it on our website within a few days after today's webinar. You can always find our recorded webinars on our website. If you just go to our homepage, allergyasthmanetwork.org, and scroll down to the bottom of the page, you'll see all the most recent webinars and upcoming webinars listed there. This webinar will be 1 hour in length, and that includes time for your questions. We will take those questions at the end of the webinar, but you can always put them at any time in the Q&A box in the panel here. And someone will be monitoring the chat as well if you have any questions or technical issues. We will get to as many questions as we can before we conclude today's webinar. We will not be offering CE credits, continuing education credits for this webinar, but we do have a certificate of attendance for anyone who may need one. And we will put it in the chat, but we will also follow up with an email in a few days after the webinar, and we will include a link to the certificate if you need it then. So let's get started. Today's topic is health insurance hacks, overcoming medication coverage hurdles. How can healthcare providers help patients overcome health insurance barriers to medication access and medical care? What do patients need to know to ensure that they can obtain and afford their prescribed medications? This webinar provides tools and strategies for overcoming barriers to medical care. It also addresses how medication access coordinators can help patients. We're joined today by Melissa Paige, president of the nonprofit organization National Association for Medication Access and Patient Advocacy, also known as NAMAPA, who will discuss NAMAPA's new Medication Access Coordinator training program. It's my pleasure to introduce our speaker, Melissa Paige. Melissa's unwavering passion for the well-being of patients fuels her relentless pursuit of breaking down access barriers and advocating for the highest quality of care for each of them. Her life's work revolves around making healthcare more accessible and compassionate for all, leaving an indelible mark on the industry she serves. If you want energy, you'll find it in Melissa. I can tell you that from knowing Melissa. As a recognized expert in patient access programs and navigation, prolific public speaker and educator, Melissa applies her unique set of medical-related knowledge, diverse pharmaceutical expertise, and leadership skills to oversee and coordinate process improvement projects that enhance business models and redesign workflows for improved efficiencies. Her passion for the patient drives her to break down barriers and seek avenues for the highest quality of care. I want to especially thank Amgen, who's provided funding support to make this webinar possible today. Thank you for being here, Melissa. I'm going to turn it over to you now.
Thank you so much, and thank you guys for inviting me for this webinar on one of my favorite topics. I know the bio is pretty long, but I think if we were to sum it up, I just don't like hearing the word no for my patients. And so we had to create a lot of infrastructure, organizations, teams together to be able to, not only help myself and my team that I was on, but everybody who's dealing with these access hurdles. And it really doesn't matter which therapeutic area on here. It's, access is a problem and a denial and prior authorizations. And I think a lot of these common terms that may keep us up at night. So excited to be here. So my name is Melissa Paige, and as Linda mentioned, I'm the president of the National Association of Medication Access and Patient Advocacy. And by trade, I am a licensed pharmacy technician, a very passionate licensed pharmacy technician, just making sure that, we take care of our patients and everybody who came through my door at the hospital and in all of my different roles as well. So a couple disclosures. I already mentioned about the nonprofit that we started, and also I'm the co-CEO of the Healthcare Advocate Summit. And that organization, it's a one-time year event for these medication access coordinators, or we'll go into kind of the different roles that can encompass. But really, what do I do and how do we support and what do our organizations support? And it's really from the physician all the way to that patient, of anything to do with access, coordination, barriers, getting that treatment. Can it be affordable? Can I get the reauth? All of these things that, when you're diagnosed or you have to let your patients know about a certain treatment or dual therapies, that, there's some solutions for them that they can actually start and stay on that treatment. So the National Association of Medication Access and Patient Advocacy, our mission is empowering healthcare advocates by providing a collaborative community focused on resources to navigate medication access and support. And so as we go through here, we're going to kind of start on some base level, just information overall, some tools and solutions, and then also some education and guides that we have put together with a lot of help from other healthcare workers, advocates, and sponsors and support that are free resources and tools for you, and almost like your phone a friend, really, which I didn't have that back when I was working in a basement in an office with no window trying to help out patients. So overall, I'm going to kind of go over just some education. You may know about these things, you have heard them, I'm sure, but just to go through, but, prior authorizations, let's talk about the word that kind of kept me up, and also, the access portion of it. But, what is a prior authorization? Prior authorization is that process where the healthcare providers must obtain approval from a patient's insurance company before prescribing a specific medication or treatment. What I didn't realize is that there are so many terms of what this can be called, and it may get confusing and, per payer or the form, but, the process might be called prior authorization, pre-service review, pre-certification, prior approval. So whatever that bucket is, it's just that step that you need to take as either for your patients or as a patient to make sure that, the insurance is going to authorize the treatment that has been prescribed. So I started right on this because usually the prior authorizations I dealt with, I worked in an infusion site as well as others, but I prepared all of my patients of just, prepare that it's going to get denied. Like something usually does get denied, but if I'm already preparing for the denial and what are the next steps, if it did get approved that first pass, they were excited. But, you got a denial. When we would get the denials, and when you do, at some point during the treatment, the insurance might deny coverage for your patient's medication or care. And if this happens, you'll get a denial letter that explains, why and what steps to take next. You may be able to appeal the decision, ask for the coverage that the doctor had prescribed. But there are different rules for appeals depending on the insurance type. And usually you can appeal it twice, once through the insurance, like an internal appeal, then through an outside organization, external. Your denial, or that denial letter, is kind of the recipe for what are the next steps. And, it may be 1 page, it may be 8 pages. It may not have a lot of information on it that you always have to make a phone call. But the denial letter will explain this in the doctor's office. Your patient will get this as well as the doctor's office or whoever initiated that. I always would call the insurance, or have my patients, if they had any questions, they could call the member service line if they would like as well. But really, when I got a denial, I'm like, okay, is this really a denial? Like, are you denying me? Like, really? And so I would have to read the information carefully. And some of the common mistakes that we've seen just on an initial request is, the incorrect insurance or benefit, the incorrect provider or ordering service, or order or servicing rendering, incorrect dates, incorrect units, incorrect diagnosis codes, or missing, other therapies that were on there. And once you've checked all of that and you read through the denial carefully, really look at it. Is it a request for information, records? And if it is a denial, what are the next options, right? Peer-to-peer appeal letters. Does the patient need to sign a consent? How much time do I have? And the timing portion is really how I would triage the patients on that. Of, how quick do I need to make sure that the information is sent in so my patients can have that right. With new therapies that came out, I'll just add a tidbit. I always knew things were going to get denied because there's no policies in place. I'm filling out like a blank prior authorization form where it says, put the drug here, no specific questions. I'm trying to answer, like, say if it was a competitor drug, trying to answer the same things that other drug was asking for, their authorization. But really, sometimes I'll let you know on our end, we knew it was going to get denied. Like, I just needed to speed up to that peer-to-peer. And so depending on, how well you know your payers, the policies, these type of things, there are ways to help expedite. And for us, sometimes I would expedite the denial process, right? Because I just needed a physician to talk to, or somebody from our office to talk to the insurance, especially on new approvals or new therapies coming out, or even new indications. On, searching for medication assistance programs. So there's a lot of programs out there. Our patients and your patients are probably searching for them, Googling them, trying to figure out. A lot of them are spam. A lot of them are services that actually charge patients money to fill out a form for them that you may already do in the office. So we always advised our patients to, call us, let us know. And I know a part of this is, how medication access coordinators can help patients. So I'll go through these. These are pretty high level kind of buckets of these tools and resources that are out there. I always advise from a medication assistance programs. You got some different stakeholders that are probably coming in from pharmaceutical companies. You've got specialty pharmacy contacts, but from a pharmaceutical company, I'll say you've kind of got your, it could be a key account manager, or it could be a sales, right? The ones who coming in, educating your physicians clinically. You may have MSLs come in that you need to talk, on label, off label discussions on, or if you need to get extra additional studies out there to submit with your OS, like there's that clinical person. There is also a person that I call, my phone a friend. I have them on speed dial. I make sure I know who can speak HIPAA to me, who can speak about my specific patient if I fill out the appropriate application, have their permission, of who can help me assist with like the offside, the authorization, what are they qualified for? Those roles go by a lot of different terms. They're usually called like field reimbursement managers. I've heard area reimbursement managers, field reimbursement access directors. Like every pharmaceutical company kind of has a different name. And right, everybody's coming in. To me, I joke with them. I'm like, you all look the same. Everyone's dressed, to the nines, really nice suits. And I don't know who can really help me in my role, right? My physician has already clinically made that decision on what they want our patient to be on. And now I need to kind of carry that ball across the line. And so the quickest way for me to find, or if I ever had new therapies or new indications come in, and my offices were always very close with those salespeople, right? Because they need to have some of this additional information, is I would just straight up ask, who can speak HIPAA with me, who legally, from your organization with the appropriate authorization can help me. And these resources have been great. They understand the payer policies. They can do a lot of additional other things of like helping us with education. We're still doing all the work as the office. They're not like the ones filling out your forms for you. But it's just a key point that I would put is from a field reimbursement standpoint. Now, why patients may not seek financial assistance, right? They may not understand their healthcare benefits, including, all these words, deductibles, co-pays, co-insurance, out-of-pocket maximums, all these terms that we see kind of acronyms on the bottom of our insurance cards. But also patients may have information overload from trying to remember all these aspects of care. And, being diagnosed, or they're hearing these drug names, or they're hearing, I need to be on an injection, an inhaler, an infusion. Like, what came to our patients' minds is, how much is this going to cost? Like, that's always their first thing. Or they're like, is there a generic? And a lot of the medications out there may not be available as generic. And so we always let the patients talk with our physicians, get the diagnosis. If they may not be ready to talk about that information, then at least, introduce yourselves and say, over the next couple of days, I'm going to be talking, and, we've got a lot of great resources to help see what you can qualify for, what your out-of-pocket's going to be. Like, we're here to help guide you. And I think that's just what they want to hear, is that they have a champion in the office, or they may have an independent patient advocate who's helping them as well, or maybe somebody in the family who's going to help have these discussions. And, you'll kind of pulse check that patient, their caregiver support as well. But really, patients may not be aware that medication assistance program exists. And, I'll say a lot of offices don't know what type of assistance exists, or if you have this type of payer, what else can you get? So patients most likely to need financial assistance. And I say financial assistance, this can be a lot of things. This can be free medication, copay assistance, all these other things, just to help them make sure that they can afford the cost of this treatment. So kind of the buckets that I put this down into is, you've got uninsured, no insurance at all, or no coverage that covers prescriptions. We've got a lot of plans out there right now that, are employer based, that they're carving out these medications, saying they don't have prescription coverage, but yet, there's ways to navigate that as well. Underinsured for infusions and injections as well, high out-of-pocket cost after insurance pays, meeting high deductibles. A lot of patients sign up for insurances based off of the cost of, the monthly premiums. And, sometimes, lower monthly cost means a higher deductible, hoping that they may not need to use it, or if they do. So depending, how that patient got that insurance, or why they selected that, you're dealt with the cards that you have at that time as you get diagnosed. But, as you go into new enrollment or additional opportunities, or you change a job, there's always opportunities to, refine that. But really, patient needs to get on a medication. What insurance do they have or don't have, and what resources are available? The next bucket is, underinsured for medication you take home, specialty medications, right? You may pick this up at a pharmacy. You may get your specialty pharmacy that your insurance is contracted with to ship to you. That's a lot of navigation. You get somebody who calls you, tells you the cost. I feel sometimes with the pharmacies, the way that I would educate my patients is always ask what assistance is available, because I think sometimes teams are trained that they have to hear some sort of distress, or a patient has to breathe a certain way, or bring up something about cost before they can go into the other services. So I always tell them, like, let them know if they screened for any assistance. regardless if they have commercial insurance or not. A lot of patients don't know that, hey, I make well, I make good money. I have commercial insurance. Like, there still are programs out for them. But with, the patients who are in this underinsured for medication that you take home for specialty meds, the coverage these patients may need to pay for prescriptions at 100% to a certain point. That's sometimes a lot, especially on these therapies that cost a lot. And you've got the patients currently employed and may not be able to work anymore, or they lose insurance coverage, right? You're on a drug or a medication or a treatment regimen. How are they going to continue to have that quality of life or to stay on their treatment? So, searching for available medication assistance programs. Every pharmaceutical company should have a website. Yes, sometimes they're very hard to navigate. They usually start on the clinical page, and there's some sort of button on there that will say, I always look for like access, or right here, right? Patient access programs, patient support programs, reimbursement, keywords, affordability, patient foundation. I usually advise the pharmaceutical companies, like, make sure these resources are available to you, to me, to everybody in 3 clicks or less. Like, it's really hard to navigate. And especially if patients are going to the websites too, they may have like a patient-facing website, right? A little bit easier to understand at their health literacy rate. But as well as for yourself. So I would say, as a medication access coordinator, as an office, make sure you kind of look at both of those websites, because there may be resources and tools, or other organizations or nonprofits that have kind of these resources and tools to help educate patients. So these are just some like terms that I put on there: patient foundation, or these keywords that I see across the websites. So for manufacturer patient assistance programs, you will hear words such as quick start, bridge, patient assistance programs, and there's some other terms that we'll go into, but I thought I would break kind of these 3 buckets down as well. So quick start programs are for patients to access the medication immediately. Think, just quick start, trying to get on that patient treatment without having to wait for an insurance authorization. It allows the patients to try the medication, see if it's right for them. Sometimes it's a 1-month supply. And usually it's the one-time supply medication that I've seen. Now, every manufacturer, every organization is different, so you really read that. And these can be for medications that can be picked up at the pharmacy, that may be available in a voucher form. I've seen some specialty meds that they use vouchers to and ship it to the patient. And each program varies on the requirements and the quantity provided. So the quick start, what I advise offices is, if you've got certain medications that are in your practice, right, kind of the common ones, see what programs that they have to like at least initiate or start that patient on therapy. And there's a lot of ways, these quick start programs, sometimes they come in vouchers that my sales teams had to come, the pharmaceutical sales had to come and give me. There may be a website that maybe I can do it on behalf of the patient with their permission, or maybe I can do it with them in the office, or maybe I need to send a link or some text message for the patient to go to and sign up for that. Maybe I need to send them to, other, I'll say coupon, GoodRx is one. There's a lot of other ones that they're already going to as well, but you can kind of initiate all of these things there. And, once they do that quick start medication, it needs to go to, the pharmacy or whoever is providing that medication, because there's going to be important information on there, right? The same like ID number, BIN number, group number, anything that they need to kind of run that in the pharmacy, that adjudication, to then it should show $0. Or, really look at those benefits on the quick start programs, because I see sometimes it's up to a certain value or dollar amount. And that pharmacy, it says on the quick start, start up to $0. Sometimes it may only cover a certain amount. So there actually is still a cost to the patient, right? And what if you hear patients calling back, just another tip, really see what that cost was of that medication at that pharmacy that they ran. and then also look at the benefit of that card. So I never promise my patients that it's going to be $0, even if it says $0, because you could run into these things based off of the pharmacy, how much they're purchasing that meds for, all these things that we have no control over. So that's Quick Start. I love Quick Starts that is just easy enrollment. I can get the information and I don't have to like wait for an approval process. So the next term that we hear is bridge programs, and this is meant to help prevent interruption in therapy, right? A patient has started on a medication and something happened, an unexpected gap in the insurance coverage, loss of insurance, change of insurance, maybe the reauth or that reauthorization didn't come through, or something, they're missing some sort of paperwork. Or I've seen, so there's two scenarios that I've seen with bridge programs in other therapeutic areas. Like I'm just speaking, I touched everything in the infusion site, all medications, including allergy and immunology. And so what I see is if you started on a certain treatment, right? Like say it's treatment A, and then there's a gap of some sort, right? They lost coverage, they need to get on it. Treatment A will then bridge you on their program. They got a bridge program, and sometimes it's 1 month fill, up to 3 times in a year, or, because you could have kind of those gaps, or 3 times in a lifetime on this product. And then I see bridge programs where it's, hey, I've started on a medication in this same class and it's not getting approved, right? And I'm showing that this was denied. Sometimes I need to show like, hey, I'm trying for this new therapy in the same class that, my physician wants to transition the patient to. And that medication says, I've seen with these bridge programs, they're like, hey, at least show me one denial, or show me the last, document down when you submitted the auth, how long it's taking. And, there's rules behind it. Is it more than 7 to 14 days? Did you get your first denial? Are you trying to go for an appeal? So these programs, they're all different. They're all meant to support the patients. And that's why I say, like, from that field reimbursement manager, you don't have to memorize everything. You don't even have to really read the fine print if you don't want to at first. Just make sure you have contact with that field reimbursement manager to then make sure that what you're reading, what you're understanding is what is the intention of the program. Or there's always some sort of telephone number that goes into a case manager at, they call it hub, but every pharmaceutical company sometimes has, it could be through chat, it could be through some other software, or you can call them just to ask some information about their programs. And, just so you know, like on that hub side, when you call, they have, 100, 200 questions, like frequently asked questions that they already have talking scripts ready to go to make sure that, what they tell you is what the program is. And, as you're verifying these things, for me, I've noticed, depending on which hub that is, sometimes I call once or twice or maybe 3 times, just make sure I'm getting the right information before I tell my patient. Then kind of the last bucket I'll say within this area is the patient assistance programs, also known as PAP is what you might hear. So pharmaceutical companies have programs that may be able to provide free medications to patients who can't afford it. The eligibility is usually limited to uninsured, underinsured, medication denials. Like there's a lot of pathways on here. It usually has, the patient has to make under a certain, they call it FPL, federal poverty level, to be able to qualify for these programs. But, and also, this is a good call at the end. Each drug company has its own rules and applications and forms. And what I found with the patient assistance programs is that they really don't publicize a lot of the information. They have kind of, if you meet the criteria, and here's some black and white. But if the patient, like say if they make a little bit over that federal poverty level, I wouldn't rule them out. I would make sure, exhaust every option that you have. And I have been successfully in our practice and others that I've seen is, you make a phone call and say, yes, they're over the federal poverty level, but this is what their yearly out-of-pocket spend on medical is for their family. This is what their income is based off, sometimes I've had to give a list of where are the patient's expenses going to? And I've listed out, the mortgage and these things, like really listed it down, even for, I would kind of categorize as some higher income patients, right? Just because you have higher income doesn't mean you have extra funding around that you can pay for expensive therapies. So just really, I mean, as you or the office, there are programs available. And of course, you want to make sure that your patients have every option before either you have to switch a treatment or they may not go on that treatment because they can't afford it, which that's not what we want. So the other area is that I see kind of easy to find a lot of the times is the copay assistance. And when I hear copay assistance, just kind of ring it with copay assistance goes with commercial insurance, right? Don't count your Medicare patients in here, because on the copay assistance, it's for private or commercially insured patients only. And usually you'll see on the fine print, it says, not for Medicaid, Medicare, TRICARE, these things. So copay assistance is usually offered for brand name medications without a generic equivalent available most of the times, I would say, on there. And like I said before, the copay assistance programs say, pay as low as $5. And this can be for pharmacy benefit medications, right? They're picking that up, they're getting them shipped in, they're getting it shipped to them and injecting self-injection at home. But also the copay assistance is available for in-office treatments, right? Infusions, injections, therapies as well. And the dollar amount on there where it's like, $0 up to this amount of money. I just always make sure to throw in that caveat that we really have to do a full benefit investigation to really figure out how this copay assistance is going to help the patient. Because the last thing you want to do is set them up for unrealistic expectations, or that patient gets treated and then they don't have an option, or they're like, I thought, you said, or I thought this said it was $0. And they only get 1 month of treatment because they're not going to go on it again. So I try to let them know, overall, like, we're here with you. We're going to help you as we navigate through this, because what you read in print, I mean, every payer is one payer, and every copay assistance program is one program. They all run differently. The last bucket, charitable patient assistance programs. So these programs are foundation assistance through disease state funds. They're most frequently utilized to cover Medicare coinsurances that are not eligible to be paid with manufacturer copay assistance. Now, read these foundation assistance, because I've seen a lot for travel assistance. I've seen other things. There's other organizations that they have a certain grant amount for the disease state, but you don't have to be using it on your medication. You can use your funds the way that you would like to, maybe towards your, copays at your doctor's office, or a balance as well. So each foundation may have grants for different disease state funds. And I'll go ahead and send, after this, just some resources of some that are out there. There's some, probably I would say 9 top ones, but in this disease state that you guys are supporting, there's a couple of them out there. And just so you know, on the foundations end, like, their goal is to make sure that they spend all of their funding that they get. And they're always going out trying to get more funding for these certain therapeutic areas. And they're saying, look, we've got a lot of patients who need help. And so they're trying to get, donations into programs to help out your patients. So medication access coordinators. So this term can go by a lot of different titles that I've seen. I've actually seen about 20. I've only put a couple on here. I feel that in this space that your teams are working in, the term that I'm hearing a lot is biologic coordinators. Just know this is all kind of encompassing the same thing. A medication access coordinator helps you get your medications, especially if there are challenges like high cost, insurance issues. Their jobs may include like working with insurance. They help get approvals, solve problems if the insurance denies coverage. They help find financial help. They connect you with programs that may lower the cost of your medications. They coordinate with the doctors and pharmacies. They make sure everyone is on the same page to make sure that patients can get their medications quickly and provide support. They explain the process and help, manage costs and paperwork and just extra education. So the other terms that I've heard is, patient assistance coordinators, financial navigators, financial coordinators, patient access team members, patient advocates, financial assistance staff members. But overall, this role, whoever is doing this role, and it may be the front desk reception person, it may be the person who's doing benefit investigations. Like this term, this role is super valuable for you and your practice, that if you are not investing in this, because of funding and other things like that, there's tools and resources out there that can help these, as long as you dedicate some time or a portion of a role to do this, that'll come back tenfold. Patients can come to your practice, they can afford their treatments, you're getting paid, they come the next time. So these coordinators, this is kind of where I sat for 10 plus years at a large health system, 8 infusion sites, hundreds and thousands of patients on here, of just kind of doing this role. And you get to know all of these different programs, and you get to meet the field reimbursement managers to kind of help educate you on those solutions. So what can medication access coordinators help patients with? Medication access coordinators, they know specific costs that are covered, specific types of costs that can be covered. They can help assist to coordinate refills, answer questions, and they help assist on looking into like other long-term solutions, right? When I had to have a patient get started, I would, okay, first goal, let's get you started. But what's the long-term solution, right? Do we need to do a patient assistance program? Do I need to try to obtain free medication while your payer is getting this on formulary? Because, free drug, I would say, isn't the solution for all. It really should be used as a last resource on this, because overall, I want to make sure that my patients can use their insurance benefits that they used and make sure that they can afford it and meet their deductibles, right? When you get free medication, it just takes you longer to hit that deductible because, nothing is going towards that from assistance, copay assistance. Sometimes helping enroll patients into insurance plans. Do you have a designated Medicare benefit specialist? Are you helping educate on there? And they also may assist with prior authorizations and other roles supporting the medication in treatments. So patient authorizations and coverage. These are some additional roles, as a medication access coordinator, finding the correct application, right? There may be an application to start, they call it usually start forms, but if they run to a certain point or they find out that that patient doesn't have insurance and now they have to go and qualify for like a free medication program, that might be another application. Or maybe the pharmaceutical company has an all-in-one 500-page application, which, by the way, if you get those forms, I always ask the reps, like, what can this form get me? If I invest my time into this form, how many steps, like how far can I bring this patient on their journey of finding solutions? Or will I need another form down the road? Or can I be proactive and get some of this information, right? You might need income information. You might need additional things for these applications. Also, filling out the applications correctly. There's a lot of questions on there. And I even get confused sometimes on there. There's like a patient's portion of the application, there's a prescriber portion. And so we help guide, there's some basic demographic information that the patients have on there that you, normally with authorization, if you can help kind of fill out that portion on there, and then the patients can sign. And also the prescribers portion. Our prescribers, there are so many different check boxes and X's and who should sign where and who gives permission for what, that really our prescribers, it's like, we would, if we printed it off, we would highlight it or DocuSign. Like the physician just wants to know where their section is, right? They're super busy. This is what we need for the prescription. Here's 2 signatures and this is what it's going to get us. So finding the correct documents, faxing the paperwork, e-faxing, uploading it to a portal, and following up on the programs. I felt like most of my day was just follow up, right? On the phone with the payers, on the phone with the pharmaceutical companies. And if I couldn't get through, and this is where I'll bring in specialty pharmacy, right? I'm also following up on like refills. And there's a lot of dashboards out there, and I think they're meant to be good, but every dashboard is different. And I still feel like a lot of dashboards are missing key pieces of information that I still need to call somebody on. And so that's the benefits of really becoming friends and have that relationship with your key account managers at specialty pharmacies, right? Like a lot of the offices, I know you buy and bill and you want to be able to service it there, but sometimes the payer is making the patient go fill it at a pharmacy. And if that's the case, and you have to use that route, let's try to make it as easy for the patient and yourself to make sure that the medication shows up on time and this. And so that's where I found those relationship industry partnerships are valuable. Or, I call them and ask them if they heard something with the payer, or have they heard any offices around me that are having the same problems that maybe they can connect me with. I always want to make more friends who are doing my role that I don't know. But also for, the infusion medications, coordinating the shipment between free drug, which pharmacy, sometimes replacement products. There's products where, if you as an office give a medication, then you got to get it replaced. But also ensuring that the medication assistance is applied correctly, to their hospital or clinic account, and they receive credit. And so, accounts and receivable, who's doing that? Because a lot of the times, I came from a big health system practice, but it's really easy to credit the wrong account, right? That wrong data service on there. So some of the things that we would do for our patients just at the end of year preparation, which this is actually in a toolkit that you can download, hang up in your office, but end of year preparation, right? I always ask my patients, is your insurance changing? Do you think it might change? Have you received any information from your employer that they're switching? Are they enrolling or changing their Medicare plan during open enrollment? Just like starting in like October-ish, we just would hone into the patient like, hey, any insurance change, and letting them know we need that so you can continue your medication January 1st. And kind of putting the onus on the patient and letting them know like where they fit in their patient journey and where they can help you to keep that ball rolling. And, if the answer is yes, then we verify the changes, we work on the new authorization on here. So this is kind of the background information, just high level, maybe deep on some portions, because I like to give a lot of tips. But tools and education, right? You don't need to memorize all this. It's a lot of work, especially if you're dealing with these therapies, maybe you're part-time. Maybe you're not prescribing this in your office except for these certain patients, right? Well, there's a whole community out there that we have created, and we put tools, education for who's ever doing this role, right? Biologic coordinator, medication access coordinator. And we've got two portions of this. You've got the education, you've got the NAMAPA community. So what is the NAMAPA community? The NAMAPA community is a free resource. Think of it like your LinkedIn, your Facebook, your Instagram. It's behind a membership wall. So you have community forums, you've got member maps, right? Who else is doing this role around me that you can connect with, right? I'm all about making new best friends. Education and resources, events, workshops, webinars, or questions. Sometimes I have a question on a certain diagnosis code or a certain HCPCS or some sort of code in my UB04, CMS 1500, whichever form I'm filling out based on the practice. It's available on the app, on Google Play. We've gotten a lot of support behind this to get this going, but selfishly, the reason why I always wanted something like this, and I knew I wasn't the only one, is I covered a large health system. And I didn't know who did rare disease or neurology or these other therapeutic areas or, allergy and immunology. I was very heavily based in oncology, but when you take on a patient, you kind of help with their other therapies too, or you step in when Sally's on maternity leave. And this is the goal of just, trying to find who knows this role. And in your office, and I mean, even your day to day, some of these terms and things that we're doing, we don't have a lot of contacts outside of our office or even know who does this type of role or even how to write a job description for this particular role. So it's a free resource. It's great. We launched this in January on here, so it's completely free. When you go in there, this is just to explain some of the therapeutic areas, right? So what does your journey look like going into this app, or it's a desktop too, is when you go in there, you then get to select like which communities you want to be a part of, right? Like for me, I covered dermatology, oncology, did some allergy immunology, or, I may bounce in and out of home infusion or something. But if I had a question, I could then go to these certain communities, right? Just think of it like as your own Facebook group or something, that it's now its own page and community of all people who also have interest that you can ping questions off of. And, of course, we don't share any patient information. It's all HIPAA compliant on here, but it's, a payer is a payer with a drug with an access problem. And I think we can help assist each other a lot with that. Or what I find in here is a lot of people are trying to find their field reimbursement managers, or a lot of people are trying to understand with this new drug if there is a copay program and what have you heard or what's your experience. We're all trying to do things a little bit better. So with this, there's a lot of things. Of course, for me, I cover every therapeutic area, but it's really neat. So you can go in, you can jump in groups or out if you want on here, but you can also, I'm all about everybody coming to the table. Any therapeutic area, any organizations, nonprofits, everybody's doing a good job. We would just like to help support from a centralized place of, letting people know in a certain therapeutic area, like what other things are out there. Or maybe you want to search in something else, what events are for that, or what organizations, right? Because when I moved over to rheumatology, I'm like, I don't even know anything about this. Like, who do I call? What events are out there? What tools and resources and nonprofits? And then kind of the second portion to this, we have the medication access coordinator training. And the training that we have is a 10-part module series, right? Think of it as 101. You're bringing on somebody new, or you just need a refresher on this. This is a very, I would say, intense but slow to pace too on understanding these things, right? The introduction to medication access coordinator terminology, fundamentals of health insurance, the overview of commercial insurance, introduction to Medicare, including, when you can enroll, when you can unenroll, what are all the situations that patients can switch their plan in the middle of the year. And so we kind of went through all of these modules on here, and it's been a great foundation piece. We were able to get this sponsored by two wonderful pharmaceutical companies to help support this from their advocacy lens. But overall, the National Association for Medication Access and Patient Advocacy, we were excited to launch this medication access coordinator training, and it just went live this year. This is a new education, and it aims to empower healthcare professionals by equipping them with critical skills and knowledge to overcome challenges in medication access. The course includes 10 modules that cover everything from, you start here, the health insurance fundamentals to medication assistance program. That was just taken from our press release on there. And so what I'm seeing with this, and leaders, what I encourage you, because I know there's a lot of people on this call, is if you have people doing this in your office, or if you're in the office doing these type of roles, try to use this as justification of crafting your skills. And we've successfully seen other organizations and even large health systems that people are either being compensated or having a discussion for maybe a little bit salary raise or maybe a bonus or something that, if you have these core competencies, one, they're going to do their job better. You understand. And then also you've got this phone a friend background. And I think, for myself being in this role, and I'm sure a lot of you out there, is like, people ask you, how do you know what you know? And it's just by experience. So we're super excited to launch this. The other two things that I'll bring up quickly before we go into Q&A is we have, between these two guides is preparing for the blizzard, right? they use this term blizzard insurance. The insurance re-verification season starts about October. So our blizzard kit that we have, it's like, what you need to do to start preparing, and it kind of goes month by month of just certain checklists. It gives patient letters to proactively reach out to avoid like those delays that they may have by not letting you know about their insurance, and making sure that you're well equipped in like how to prepare for the next year or two, which then you kind of go into starting the new year and all those things that I talked about of authorization types. There's a lot of nuances between medical and pharmacy benefit, continuation of care, drugs with classified and unclassified codes, right? How do you, like when you're calling in for an authorization, you could call and say, is there an authorization? No. There's like 10 other questions you could ask to really drill down to make sure that what you're asking and like how to prep yourself, and like even when you call back, what you need. So these are also free resources that we have available. So with that, this concludes my portion of the presentation. And, going through, as you can tell, super passionate about this, but I will turn it over to the group to see if there's any questions and answers.
Thank you, Melissa. This is such a off topic for our usual webinars that this is just new information for a lot of us. And it's just so great to have somebody like you that's so experienced in this that can really just pull it all together. And so I really appreciate that. So one of the things, as Melissa said, is they have this wonderful training program, and it's free because of sponsorship from Amgen and AstraZeneca. Is that correct, Melissa? Did I get
that is
right?
correct. Yes.
Yeah. And then in addition to that, Melissa all co-organizes this annual conference just for medication access coordinators. And you just had that a couple of weeks ago or so, right? And that also right now you can see or listen to all the recordings from that because of sponsorship as well. Do I have that correct, Melissa?
That is correct. And what I'll do after this is I'm going to provide everything. But if you end up going, I'll provide you the code to put on the email. But we did get a sponsor that we have access, or anybody can have access to about 80 plus sessions. And there's continuing education for 5 different licenses in there. And even if it's not for your license, I've seen you be able to get continuing education, but great resources on inflation, the IRA coming up, setting up programs in your office, advocacy, a lot of these things. So we encourage, it's a pretty low rate to attend. It's in Las Vegas, going to be every year, but we had that at the 1st of September, and it was a great success. Every year it just continues to grow.
Yeah. I was kind of living vicariously on LinkedIn every day that you were there and reporting out on it. So definitely something to think about for next year, but you could actually access the recordings and check it out yourself now. The other thing I just want to say is we've been working, Allergy Asthma Network has been working on patient-facing information. So this was really for medication access coordinators and office staff to learn more about this whole process of insurance reimbursement and getting access to medication. But we just launched, with the help of Melissa and her team at NAMAPA, a patient-facing set of resources on our website. We call it an insurance toolkit. I just put the link to it in chat, and we will include it in the follow-up email to you so you can access. But this is all written to be readable and understandable by patients and families so they can understand better the basics of insurance coverage and, where to get help if their medication has been denied. And we definitely kept health literacy in mind. So we brought this complex information down to a reading level that we hope is understandable to the majority of people. But there's more. I feel like a TV commercial for this. We also have a biologics podcast that just went live last week. Dr. William Anderson did a wonderful job talking about the office-based, doctor-based perspective of trying to get patients access to biologics that they need. And we all know that those are so expensive and are the greatest challenge. We do a podcast series in conjunction with a group called the Itch Podcast, and they did a wonderful interview with Dr. Anderson. It just went live this past week. So I will put the link to that in chat as well. And then in early October, we're going to have 2 more podcasts with the Itch where Melissa and her team are going to be interviewed. One is going to be, again, about this same topic regarding medication access coordinator training, but it's going to be podcast format. And then we're also going to do what to do if a patient is denied access to their medication. So it's more for the patient focus. We have additional resources too. I don't want to keep going on and on. Like I said, we'll include them in the follow-up email. We're also going to be doing videos on our social media accounts regarding key topics related to insurance access. So people who utilize those channels will be able to hear about, get tips and strategies for trying to navigate this themselves. So I just want you to count on us. We're working really well and closely with Melissa and her team at NAMAPA so that we can try to get as much information out about this important topic. It's a major advocacy issue for us, and it's a health equity issue. And so we really feel like if we can handle it through our mission areas of outreach, education, advocacy, and research, then we're doing a service to help everyone. And so that's why we're really committed to this very important topic. So with that, I'll see if there's any questions for you, Melissa. I kind of went on and on. What assistance is there for Medicare patients for things like macular degeneration? Do you know, Melissa? I know this is a little bit off topic for.
They're so specific as far as the assistance for certain ones. I think the best tool that I've seen out there, it's called Pan Fund Finder. And you can go in, they kind of do an aggregate of all of these other foundations on there, and you can go in there and drill down exactly for that. But if you end up, if you can't see something on that, please feel free to email us and we can look as far as other resources. So we're tapped into and friends with all of the different foundations who help also support our conference too. But those specific resources, one, that would be a great question for the chat or that community group as well. But the PAN, P-A-N, Fund, F-U-N-D, Finder is one that you can log in and just, you can see all the diseases and it'll tell you which is open and which organization does that.
Great, thank you. Again, is there a cost to the medication access coordinator training modules?
No, there's not. We have patiently been waiting for the right partners to come to the table to help provide this information for free. So it is available for free.
Great. One last question. How do assistance programs affect Medicare Part D donut hole?
So Medicare assistance programs, like if you're, I would say, depending on what that medication assistance program, if that patient is getting a free medication, right, they're not using the insurance at all. If they end up getting assistance through a foundation grant, right, because grants can help out Medicare patients, co-pay programs can help out commercial patients, that will help with their out of pocket. So when you usually get approved for a certain disease state or things, it could be, you know, $2,000, $5,000, $10,000. But with the changes in Medicare that are happening, which NAMAPA, we're going to be doing 2 webinars coming up on, you know, how are the new changes with enrollment going to help out patients for next year and what that looks like as well. So as far as foundation assistance, I'll consider that foundation assistance, right? Funding will help out with that patient's out of pocket. So whatever that patient responsibility is, that's the portion that they can go ahead and help out with. Now, if it's free medication, right? Say they were denied or somehow they weren't able to get funding and they were to get approved through a patient assistance program, which normally, just so you know, patient assistance programs, sometimes they deny you based off of, no, you do have insurance, regardless if it's whichever type of insurance. But for Medicare, just make sure you call in and ask what are the steps? Is there appeals processes? They don't put this publicly on there. So I hope that helped out a little bit.
Well, thank you. Well, it's 12:59. We did a great job of ending on time. Thank you so much. This has been so informative. And for everybody who's on the line, we have 2 webinars coming up in October. First, we'll welcome Dr. Bill Berger to discuss chronic urticaria, that's chronic hives, and how to meet the needs of patients. That's going to be on October 16th. And on October 31st, we'll welcome Dr. Rajan Merchant from California to discuss biologic medicines, what they are, how they work, and who might benefit. You'll receive an email from Zoom in a few days with links to recording and evaluation and supplemental resources like we told we would share with you today. Thank you again from all of us here at Allergy and Asthma Network. Join us as we work every day to improve the lives of people with allergies, asthma, and related conditions. Thank you again, Melissa. Thanks for joining us
Thanks,
today,
guys.
everyone.
Take care.